Lateral elbow pain is probably the most common elbow complaint I tend to see in the office. This usually presents in middle-aged patients, and they'll complain of usually an atraumatic, insidious onset of pain to their lateral elbow. It's usually made worse when they grip or pull. A lot of times it will wake them up from sleep at night, and their elbow is very stiff in the morning. Usually there is pain with gripping over the lateral elbow. They do have some weakness, and usually this is not associated with any injury. In the past, this is called tennis elbow, but the majority of people who tend to have this do not play tennis. They can be laborers or just housewives. This is basically a pain syndrome of middle age. It's due to a degeneration of one of the tendons that allow you to extend the wrist. The treatment is having a long discussion with the patient that this is a self-limited pain syndrome of middle age. There is nothing broken in their elbow, and that by using the elbow, they're not going to cause more damage, despite the fact that there is significant pain. The initial treatment is a long discussion on the problem, trying to use a counterforce brace when they're up. We show them specific stretching exercises to do 4 times a day, and also to avoid lifting, pulling, or pushing with their palm facing the ground. Usually some Tylenol or some simple anti-inflammatories or ice are also used. This is a problem for which there is no quick solution, but if the patient follows my lifting, pulling, and pushing protocol along with using the brace and the stretching exercises over a period of months, which can be 4, 6 to 8 months, this pain is reduced and usually will disappear over time. This is a disorder that very, very rarely requires an operation, and should very, very rarely, if ever, have an injection for. The injections give very minimal relief, and usually there's a rebound of significant pain after the shot wears off that's much more severe discomfort than the patient initially presented to the doctor for.